As a physician, your time is valuable. Your tax strategy should be working just as hard as you are. But with complex regulations, running a practice, and managing your personal finances, it's easy to overlook opportunities and overpay. PRS Tax Planning Services helps doctors change that. We specialize in tax strategies built specifically for physicians, designed to help protect your income, reduce your tax burden, and support your long-term goals. Whether you're starting a practice, paying down debt, or planning for retirement, our advisors work with you to create a clear, personalized plan. The goal is to spend less time worrying about taxes and more time focusing on your patients and your future. Visit physiciansrs.com/tax to learn more about PRS tax planning services. That's physiciansrs.com/tax. Smarter tax planning for doctors.
Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain, because here, you are both patient and physician.
Hello. Welcome to The Patient Physician. My name is Paul Smith, and I am joined today by my co-host, Chris Fulbright.
What is up, Paul? How are you, buddy?
I'm good. Thanks for making the time to be here. I know that you got in really late last night from your flight.
Little weather stuff, but we're here and we are happy to be here. I'll tell you that. So we're all good.
Well, today we're discussing the role of chiropractic care and healing, along with sustained wellness, some collaboration with specialty-specific doctors, and if we can get to the outdated stigma around the modality and where it even came from, because I'd like to know more about that. But today we are joined by Dr. Christian Nelson, a chiropractor, husband, dad, patriot, and Christian. He was a cadet in the Civil Air Patrol as a teen, and then he met his wife, Mary Catherine, at the end of high school. Went on to college and graduated with a bachelor's from Texas Tech in 2015. We are not going to hold that against him. Got married to Mary Catherine and then graduated with a doctorate in chiropractic in April of 2019. He then started practice in the very same month. Shortly thereafter, he started Advocate Wellness in January of 2020. Welcome to the show, Dr. Christian Nelson.
Thank you so much. Thanks for having me, guys.
Well, thank you for joining us. And I have to start with where I ended on that. You started your practice in the same year that COVID hit. So tell us what that was.
Yes, I did. Oh man, that was pretty wild. So I was dealing with a lot of the same problems that a lot of chiropractors do, where we are pretty darn good clinicians and we are amateur businessmen. So it hit me pretty hard. I was grateful to be in a county where we were still considered essential personnel. And so we were not nearly as limited as some doctors were in a neighboring county. So if you're from Texas and you're in anywhere near Tarrant County, yeah, it's pretty cool.
So that was a reality that actually it was helpful for you, that there was a county that was not considered essential, same specialty of care, but in Tarrant, you
Correct.
were fine. Wow.
In Tarrant, we were fine. In Dallas County, they were considered non-essential. And so they were limited to seeing only their most severe patients. There were severe limitations on spacing and all of these things, which it turns out were, in retrospect, I think it's fair to say were almost entirely unnecessary and were quite a panic response. So it impacted them a lot more than it did me. For me, it was still kind of rough, but not too bad.
Yeah. Well, what a time to have to try to open a business. I know that impacted a lot of small business owners, put a lot of people out of business, frankly. And
it did.
Some really haven't even recovered yet, but you made it through. How long before you really saw things sort of level out and feel like you were running a normal practice?
Probably a year and a half.
Okay. I'm sure you learned a lot through that process, but let's go back a little bit if we can. And why don't you share with us a little bit about what even drew you to chiropractic care, and maybe even if you knew the moment that was going to be your path.
Yes. So thank you. I love talking about my chiropractic story. So I grew up out in the farm country out east of Austin. There's a little town called Elgin. I grew up out there off of 290. And grew up on a little farm. Are you? Oh, that's wonderful.
We're not far from there.
Yeah.
Okay. All right. Fantastic. So that's where I grew up. My parents raised us out on the land. We were barefoot more than half the time. It was great. But that also meant with a lot of maintenance. So I was digging fence holes, and we had pole barns to maintenance, and all his property. And then I also played soccer. And out there in that part of the country, there's red clay that's so good. The Acme Brick facility is 2 miles from where I grew up. So when you wiped out and hit the dirt, or if you fell off a horse, or if you fell out of a tree, which, growing up as a teenage boy, I did a lot. You took a lot of impact. And so all of that kind of culminated, and I ended up in a lot of chronic pain. I was probably rolling at about a 6 or 8 out of 10 just on a normal day.
Oh, geez.
Wow.
Could not sit still for more than 5 minutes without having to do the little shifting sort of thing. So paying attention in classes became difficult, staying focused with schoolwork. Yeah, so like a lot of that piled up. My mom took me to a chiropractor over there. I think he still practices over in the Pflugerville and Elgin area. Dr. Hollis Wilson, amazing dude. He changed my life. I walked in at an 8. I walked out at about a 2.
In that same visit?
In that same visit.
Okay.
Wow.
Yep. I was hurting a lot, and I walked out extremely relieved, and I went home and I slept for almost 36 hours.
Oh my goodness.
My mom literally had me fog a mirror because she's like, "Is he dead?"
Oh my gosh.
I woke up in there, drank a gallon of water, ate about 4 peanut butter and jelly sandwiches, went right back to sleep. I have no memory of that, but they told me that zombie walked into the kitchen, just slammed a bunch of food and went right back to bed. I was like, okay, checks out. I was like,
now, where were you feeling the pain in all this? Because you said you were at an 8, but was it all over at this point, or
a lot of it was neck and low back.
Okay.
Super tight hip flexors. My low back was pretty locked up, and I had a fair amount of neck pain, a lot of shoulder tension that was rolling me forward. So yeah, that's where most of it was. So I wake up on Saturday for my follow-up. They had to wake me up, and I'm sleep drunk, and I walk into Dr. Wilson's office, and I'm sitting there. I'm just kind of taking it in. It was a beautiful office. It was a renovated house. And so there were bright colors. It was friendly. It was inviting. It was nothing like the whitewashed little, like almost psychiatric looking clinics that you see in other places. And, they knew my name. I was expected. And I'm sitting there. I feel great. And the door opens, and this lady pushes her husband in a wheelchair. I was like, this guy's in a rough shape. Doc comes out and asks us, "Hey, do you mind if he cuts the line?" Go right ahead. Yeah. Obviously, he's hurting worse than I am right now. I'm good. 20 minutes later, the same guy comes out pushing his wheelchair. And for me, that was a breakthrough moment. I thought to myself, this is so cool. This is biblical. Like, the lame walk out of here. Later on through my studies, I would go on to see through like eye rehab and other things like that, vestibular rehabilitation, something that chiropractors can do depending on the state, to where people who were functionally blind could see, and the lame walk, and feeling was returned, healing, function, all of these things. And that was my first taste of that. And that was when I made up my mind that this is what I was going to do. I already knew I want to be a doctor, but I was like, this is cool.
Wow. And you were only 15, I think, at that time, right?
Mm-hmm. That's correct.
That's a pretty significant impact. And I would tell you that doesn't oppose a lot of the different stories I've heard from other physicians that we've talked to and worked with. There's always some poignant moment in their life that causes them to look towards a specific specialty, some impact in their family or something like that you shared. And so, grateful for people like you that take that moment and are inspired to go then help change lives. So I want to read something here really quickly. And I think it feeds into the, your approach in your clinic. Never underestimate the impact of connecting with and healing one person. The ripples affect many more people than you can imagine. Who said that?
I don't remember off the top of my head. It sounds
Oh
familiar.
no, that you're going to get in big trouble for this, Christian, because that was Mary Catherine Nelson was what it says on your website. You're busted, buddy.
I was like, that's not me. That sounds, gosh, that sounds awful familiar. No, that sounds like something my wife would
from
say.
somebody much wiser. So we're gonna have to edit that out or something for you. Anyway,
no, leave it in. It's fine. It's fine.
Just edit his response, and he'll be like, "That's my soulmate. She said that."
That's right.
Obviously, yes.
Yes.
No, I read that and I thought, how wonderful. First of all, you can connect with that as a patient, but then, we see a lot of times where, specialty physicians or those that actually are private practice will have family members that are involved. And I don't know how much your wife is involved in your practice, but, you bring in an essence of that and then sort of that idea of just connecting with the person in front of you and helping them out the best that you can. But that feeds into the philosophy. So if you can take a second and share that, because what I also thought was interesting was, your comments around how we are all so busy and running really hard and fast. So can you walk us through how that phrase said by your wife and feeds into your practice and how you approach patient care?
Absolutely. So it can best be described as a term that I think is credited back to the founder of the Chiropractic University I went to, Jim Parker. He was a pretty famous chiropractor, and he coined it as present time consciousness. The more time you could spend in PTC with the person in front of you, the deeper the connection and the more you are able to pick up on the little nuances that patients present with that sometimes make all the difference in the treatment, the diagnosis of their case, and therefore how their life turns out. Their experience with you, but then also like those ripples that Mary mentioned as far as like how they just like go out into the whole world. Because if you miss a small detail as a doctor, it could be the difference between them having a mediocre experience or worse, and them having a life-changing experience that then their life can never be the same after that. They now have a story that they can tell people. Like Dr. Wilson made one of those experience happen in my life. And now I do what I do. So it's less distracted, more focused, a mile deep and an inch wide with a person actually in front of you. The world always is trying to distract us from what we should be doing. And if we live our life as Christians properly, then we're doing everything as unto the Lord, which means when you're treating the person, you should be treating that person and not worrying about the next person and not worrying about the previous person or, someone's opinion with an alphanumeric account on Twitter that said some mean things about you last night. It doesn't matter. Be with the person in front of you. And then treatment becomes a form of prayer.
Do you get a lot of feedback from patients that they maybe went somewhere else and, now if you're taking that approach that they feel like they're more heard or they're spending more time? Because I feel like just kind of reviewing and looking, I've been to those places and I don't even think that it's because they're bad clinicians. I think it's just because that's the setup that is the business model. Yeah. And so I'm curious. I think that more physicians and people would like to spend more time with their patients. I don't think any one of them wants to see 50 patients a day. Yeah. Not really.
No,
I think they'd like to spend.
Depends on
how are you doing that? Yeah. How are you doing that you're able to take that time that more people would like to?
So I see about 10 to 20 people per day. And what I found pretty early on is that if I actually made the visits longer, there was less time for hello and goodbye and how are you doing today, and more time for treatment. So I could see someone for 3 10-minute visits in a week or one 30-minute visit. And there was actually more treatment and more connection. And I was able to see evidence of more healing with that 1 30-minute visit per week than 3, 10, just in, out, quick. Because then they're coming in, they're rushed. I live in the Dallas-Fort Worth area, closer into Fort Worth. Traffic here is notoriously bad. People come in with their shoulders up around their ears. It takes them a minute to just calm down and actually for that focus to return to the inside of their body instead of everything outside of them, so that their body can actually do the healing process. If you want to, we can talk about fight or flight and how chiropractic can affect that positively for long-term healing. But I found that like longer visits actually were more effective. And so I just have fewer of them. And then people like that because there were fewer interruptions to their schedules. I don't want to go see somebody 3 times a week for my health. I'm not going to lie. I'd rather go once if I could and get the benefits. Like that sounds fantastic to me. And it also allowed just like more effective time for treatment, more connection time, a better relationship, more time for questions to come up too. I found that to also be the case when you're going through a clinic where just the way the model is, again, good clinicians work at these sort of places. Some of the best doctors I've known actually end up getting a job at these places where they're seeing 50 to 100 patients a day. And they end up burned out. So they end up not delivering their best possible care. And the patient doesn't have time to ask questions, with a few exceptions. And this is where I said it depends on how it's set up. There are some offices where the visit will be longer and the doctor's time with the patient is shorter, but then the staff has some of that longer time with the patient. I've seen that work really well too. But I chose to go more of a boutique route where their treatment time is pretty exclusively with me.
That's so funny, Paul, because I didn't know that you were going to go there, Paul. I actually went to the same thing. So, Christian, I got stuck. If you do your analytics on your website, you're going to see someone who's been on your website a long time. I've been reading your reviews. And so it's so interesting that Paul and I kind of connected this same thing. It's over and over again. Dr. Nelson spent time with me. He listened to my questions, the depth in which you go. And so Paul and I have talked to so many physicians, both on the podcast but in general, and exactly this bifurcation of I need to see 30, 40, 50 people a day. I've got to have a staff. And, we tape off the hallway so I don't get distracted. We bring me over here. I've got AI notes and everything. And so it's this thing where when I read your reviews, it felt to me this intentional redirection of doctor-patient relationship, right? Where you come in and you take, and we were joking with you about this beautiful blue color behind you, and you can tell that you're very intentional about the way that you do things to get people to come and relax. And so you built your business, you built your practice. Obviously, other people do it different ways. How many iterations did you go through until you kind of came upon, hey, 10 to 12 is the right number for me? Because you can get pulled into more is always better. If I can see 10, I can see 20. If I can see 50, then I just need to have 2 more staff members, and then I need to have that, right? Or that quiet time when you were describing earlier of you being in this beautiful setting with bright colors and a remodeled home, and the personal relationship of saying, hey, Christian, do you mind letting this person go in front of you? That moment of time of relaxation changed your whole path. And so I'm fascinated to listen to your story more and find out how did you choose that path of your practice to go deeper per client or patient or however you refer to your people that you're assisting?
I refer to them as patients. I think there's a lot that needs to be done to reclaim the proper relationship between doctor and patient. Society in general, I don't want to go down too many rabbit holes. Unless you guys just want to go, we can roll. Society's hyper mobilized. We don't know people as deeply, and we don't know them as long as we used to. And in a societal setting, there's some advantages with this. You can escape bad situations more easily. That's an upside. But a downside is you don't have roots and you don't have long-lasting relationships with people in the area where you are. You don't know your neighbors. The doctor in town didn't treat your granddaddy, your daddy, and you, and will treat your kids, depending on how that goes, because you're always moving every, 5, 10, 20 years, maybe even more often. But I found out 2 things about myself. First off, personality. I like complex cases. I like puzzling things. I like difficult situations, I found on pretty early that clinically speaking, I was good at figuring out the root cause of complex problems. And so I wanted to make sure that I was in a situation where I could treat those situations. And that just requires time to sit down and listen to a patient. It's the first thing I do is we take about 15 to 20 minutes just for a consult where I just ask questions and then more questions. And then what have you not told me? And do you have any of this, that, or the other thing that may be related to this other thing that you didn't think you needed to tell me because you thought chiropractors couldn't help with XYZ? They're like, oh my goodness, yes. And I'm like, okay. And then when did you get a car wreck? Like, did you get T-boned on your left side like 20 years ago? And they're like, how did you know? It's like, it's right here in front of me because I took the time to listen. So the commoditization, the mass production of medicine has completely upset the proper nature of the relationship between doctor and patient. And that's something that I try to reclaim in my practice and set an example for other clinicians as well that, hey, you can have this too. And there are other doctors colleagues of mine that are fantastic where they figured out how to scale this up a little better. It really depends on having exceptional staff. I have found that I'm not super good at hiring people, so I'm working on that skill set before I go to scale. Because if the experience does not continue in this way, then I'll have undermined myself.
Yeah.
So I want to switch gears a little bit here, because you're focusing a little bit different, at least from what I've heard, where you're working in and collaborating with other physicians. And chiropractic care is one of those things that sort of sits in between, at the intersection of medicine, between physical therapy and wellness and some of the other treatments that a patient could get. So can you walk us through what you're doing and collaborating, or how you're navigating that space with other clinicians or specialties?
Absolutely. I'd love to. So the possibilities for collaboration between chiropractors and other clinicians is almost endless. What we do ends up looking a little bit like physical therapy, and we can offer some rehab things as well. But the primary thing, single most important thing that chiropractors do is delivering a chiropractic adjustment. That is specifically for the nurture. Yeah, we could say the nurture of the nervous system, primarily the spinal cord. We can also affect cranial nerves and stuff like that. And so the implications for it are not just pain, not just return of sensation, dealing with numbness, tingling, burning, shocking sensation, sciatica, that sort of thing. We can also help support the central nervous system. We can decrease the amount of stress on the brainstem. We can help support good, healthy eye movement. So we could coordinate with people, dentists. We can help decrease jaw tension. So people not cracking their crowns immediately after. Decreased pain has implications for mental health. Chronic pain is shown to worsen every single mental condition that people suffer from. And so if we can sort that out and co-manage with a therapist or a psychiatrist or someone who's helping them with their mental struggles, that will be even better. Also, there's no other doctor that particularly concerns themselves with the optimal function of your nervous system the way that chiropractic does. We own that space. Nobody else does, right? They might be pathology focused, but nobody is like optimization of the nervous system the way we do. And so what could not be improved by having a healthy, thriving nervous system as well as getting the focused care of another specialty? So I don't see myself in competition with anyone. If you're rehabbing, doing PT and chiropractic, fantastic. The chiropractic will help make sure that the nervous system is as connected between brain and body. So you get maximal recruitment, maximal strength gains, best coordination possible so that your exercises are as fruitful as possible. Some people see us as in competition with PTs. I don't see it. Massage therapists, they can help to relax things. I can help make sure that the spasms don't continue. Because if you have a nerve root that's really inflamed and that muscle spazzes, you can rub on it and push on it and stretch it all you want. It'll be back in 1 or 2 days, just as tight as before. If you have somebody with eye problems, vision problems, we talked about mental health, obstetrics, labor and delivery. If a mom is super stressed, her birth outcomes will not be as good. If we can help to nurture that nervous system, help things to be calmed, have a proper balance between fight or flight and that rest and digest system, that parasympathetic response that is actually required to have a really good, healthy, fruitful birth with minimal intervention. Hey, that's awesome. So I'll cooperate with like OBGYNs and stuff like that on that. I have a neuro-optometrist that I cooperate with. And I tell the patients, I'll take care of you from the ears down. He's got you from the ears up. So those are just a couple of examples and specific ways in which chiropractic can help to, you can look at it either way. Either we're taking the lead and they're supporting a specific aspect of the health, or they're taking the lead and we're helping support the best healing possible.
So what does that look like from a practical standpoint? Are you receiving somebody that's coming in and seeing you, or are you getting a referral from them and then you're just getting patient permission to share, information back and forth to communicate? And are you talking with this other specialist, or what does that look like from the patient side?
From the patient side, I always make sure that I tell them, hey, I'm going to keep the most complete record of your health. Anything that's going on as possible. I am grateful first that I get to take the time, that I have this practice where I can take the time and really listen to you. And then I can also say, hey, if at any point I feel like someone else is a better fit for your care, I'll tell you exactly who that is. So I might say, hey, okay, you need to go see so-and-so in addition. Or I might say, you would be completely better served at that clinic. You need to go do this focused for about 6 months and then come and I'll call you and check back in with you. And so I've found that other clinicians, just again, due to the nature of how their practices are set up, end up very focused on one specific aspect of the patient's health. Very few other clinicians. There are a couple of functional medicine doctors, usually DOs or FNPs, like nurse practitioners, love them so much, where they are concerned with overall health. But typically, I'm the only one in that person's team of doctors that is looking at their overall health. I'm not just looking at pain. I'm looking at mobility. I'm looking at organ health. I'm looking at energy, sleep, digestion, detoxification, long-term immunity. And I can put those things all together. I have a framework through chiropractic and through my postdoctorate education to help me be able to look at all of that side by side and be like, well, you're dealing with this issue. Have you also been dealing with this other related issue? Because I'm seeing the whole picture. So, I hope being my patient is pretty cool. So far, the feedback seems pretty awesome.
Well, is it take extra time for you to communicate, or maybe you're not really communicating with this other specialist? That's where I'm trying to wrap my head around. What does that look like?
Oh yeah, no, I'm sorry.
Of it is no. I think that the idea of I'm trying to think about which. I don't know if you're doing this or not, but what I'm trying to understand is if you are, it sounds like that would be great if the specialists are talking to each other to both understand what is actually going on with my
whenever
health,
they're receptive.
Both of them. Yeah. Okay. So are you finding that that's not really
whenever they're receptive? Yeah. Well, some doctors are either I get filtered out by their MA and the word just never gets to them because they are behind about 3 different levels of privacy screening. You have to find the direct number to the office. Then you have to get through the MA and then you have to get through the doctor's schedule and somehow find your way to the top of their to-do list. They are so crazy busy in some cases. So a lot of times I'll just send a summary letter and just fax it over to the office because then I know if I fax it over, it has to get signed by the doctor, and at least there's a chance that it gets into the conscious memory before it gets signed. I suspect some things are getting signed and just entered in without full reflection. Again, I don't know if that's I'm going to blame it primarily on the pressure and credit the doctor as, just being really busy. But there's sometimes when I don't hear back from them at all. There are a couple of specialists who I get to cooperate with, and I'll call them and just give them a weekly or monthly update, depending on the severity of the case, on what's going on with their patient, what I'm seeing, if they have any questions, any things they want me to do or not do, and just walk them through those concerns they might have or help them see the benefits of additional things I could offer.
Do you think they're finding the offering and the assistance from you helpful, or I'm just wondering how they're receiving that? I absolutely believe that there's a timing issue, and they are all just like we're all busy. Your site says that everybody's very busy. We all have somewhere to be and something to do, but I also can't ignore the fact that I'm sure there are some that are just resistant and don't want to cooperate for whatever reason, busyness or other.
Thankfully, there's less stigma about chiropractic now than there had been in times past. Yeah. So like most of the doctors who are, I'd say the turning point is about 50 years old, where 50 and above, like they're still a little salty. I introduced myself as a chiropractor. They look at me at 33. They're like, you're a young whippersnapper, and then you're also a quack. So I get that occasionally. It tends to be from the old guard, but at 50 years old and younger, pretty cooperative, generally quite friendly. They might be a little cool about it, but they're not openly hostile. I haven't received any, not much, maybe a couple instances.
Okay, so what's the stigma?
I just tipped my hat.
Yeah.
So
what is the stigma?
Chiropractic was pioneered in the late 1800s here in the United States. Physical manipulation has existed through, history in a lot of different cultures, but here in the States, it started in 1895 with D.D. Palmer, and that's when chiropractic started and was kind of coined at that point here in the States. If you guys are familiar with the Flexner Report, it was put out by the Carnegie Institute in about 1910. They took 2 years to study a bunch of different medical schools around the nation to determine which were quacks and which were legit. A lot of naturopaths got thrown under the bus. The chiropractors were mentioned only briefly as unconscionable quacks who should be dealt with by the magistrates. And so that was kind of the start of,
That's a strong worded sentence.
So hateful.
Yeah.
Very, very. And it was so dismissive and so offhand and so just very brief. It was like, I haven't read the full report. I have other things I want to just direct my attention.
I would have probably put it down after those comments.
So dismissive. And so for there was a lot of then prosecution of chiropractic as practice of medicine without a license, even though we operate on a completely different basis, a different philosophy of healing, an inside out approach to healing where we believe the body has everything it needs to heal, provided it's not being starved or poisoned, right? It has everything it needs to heal without outside factors. And you need outside factors only if your body's overwhelmed, say in a surgical case or an emergency medicine case where, like, let's say you're bleeding out. Don't come to me for an adjustment. Okay. Just go to the hospital. As soon as you're stable, right? As soon as you're stable, we're no longer in an emergency setting. That's when I can do my best work for a patient. And so, like, we do cooperate with emergency medicine and on some grounds, but the goal is always inside out for us. And the primary form of healing for the medical model is outside in. There's something else that has to save you, which is true in emergency cases. And so we have a different philosophy. And up until 1975, chiropractors were getting jailed for adjusting. That was the state of Louisiana. It was one of the last ones to pass a Chiropractic Act in 1975.
1975.
Backtrack a little bit.
Mm-hmm. My goodness.
Yeah, in 1963, the AMA started a committee on quackery with the express intent of containing and eliminating the chiropractic practice. So they just kind of picked up where the Flexner Report had left off, and they spread a lot of bad blood. They defamed the chiropractic profession a lot. We won an antitrust lawsuit against them in 93, and they were told to disband that committee and to cease their open hostility, which they did. And since then, I think the relationships between chiropractic and medical professionals have improved a lot. Political medicine still has it out for us. The individual medical practitioners are fantastic to work with because they get to see the results of what we do. And so long as we're careful, we know how to talk about what we're talking about, and we cooperate well. Like I said, like differentiating between what's a true emergency situation and what's a chronic health situation where we really shine, then they're fine. I've had patients walk in having an active stroke, and I was like, you're going to the hospital. And
do you treat any physicians?
Kind of some of that stigma. I do. I have dentists, dental assistants, other chiropractors. Those are my favorite. Couple of DOs, MDs, ophthalmologists. Yeah, PTs.
I mean, I would imagine that it would be helpful. Some of them have very rigorous and physically demanding schedules.
Absolutely. But everybody's got stress. And you look at the 3 different levels chiropractic can be delivered at. Can I dive into that for a moment?
For sure. Please.
Yeah.
Cool. So the way I explain chiropractic to people is there's 3 levels of care you can receive. The first one is pain relief. This is where the pain is getting in the way of everything like in your life. And it's like migraines keeping you on the couch, like taking you out, like you have to call in from work. You can't do stuff anymore. You can't lift your kids. All right. You need pain relief. That's going to be the primary focus. We're looking at a more mechanical sort of approach to things. Where does it hurt? That's where we focus. That's what we fix. The next level is strengthening. Just because you're not in pain doesn't mean you're operating optimally. You actually only have pain when you've lost almost 50% of function in a joint in the spine. That's a lot of function to lose, a lot of coordination. And so we want to strengthen things, make sure everything's connected and working together. That's level 2. Level 3 is an optimization, where we're working actually at balancing out your nervous system. Between the neck and the tailbone, housing your parasympathetics, or your rest and digest and congest. So your ability to have intimacy, your ability to be able to relax, to be able to eat and digest your food properly, to detoxify, to reset and refresh your brain for the next day. That's all under parasympathetic control. We can access that from your neck and your tailbone. In the middle of your back, right next to your ribs, is your fight or flight system. So your freak out, your fight, your like shoulders up around your ears, all external attention is regulated from there. It's designed to keep you alive in emergency situations. Very, very good. We need it in those moments. But what I find is that a lot of people are pinned at red line, and they're so stressed out from work, family situations, societal situations, spiritual problems, that they just walk in with their shoulders up around their ears, and they might not have any pain, but they might be really tight. And then their nervous system is not getting to that resting state at nighttime. So they never stop going. And at that point, the body's going to break down way, way, way faster over the long term. And so helping them have a flexible nervous system that ramps up during emergencies, but as soon as they're not in an emergent situation, actually calms back down again. That's what most people don't do, is they don't actually calm back down again. That's where there's huge potential for long-term improvement. Decreases in arthritises, nervous system disorders that show up in the gut, so IBS and a lot of things like that. Immune disorders, because if you're stressed out, your immune system just takes a nosedive. What else? Yeah, so those are the 3 levels. Just, acute relief, strengthening, and then optimization. Think of it more like balancing. So
you've mentioned this fight or flight thing several times now. Can you go a little bit deeper on that? I mean, obviously we all know we're under stress,
sure,
but it seems like something you're seeing on a recurring basis that's top of mind there for you. Can you go a little deeper there?
Absolutely. What would you like to know? How it shows up in a patient's life?
Yeah. When you're seeing somebody to come in and you're like, okay, I can recognize the shoulders. You're talking about some visual cues there.
Mm-hmm.
Like somebody's like, hey, I'm not in pain, but there's something that's going on. What is it in your mind as you're asking questions, right? And you're trying to paint that bigger picture of the patient. What's happening there?
Absolutely. So there are some outward signs you can pay attention to: pupil dilation, sweaty palms, breathing rate, blood pressure, respiratory rate, tension. So the amount of guarding that people are doing, the amount of elbow tightness. So if you walk around and you notice that your arms never fully straighten, like that's because your brain thinks it's in danger. And so the proper response is to cover your carotids with your shoulder, because if you get poked here, it's a bad day. Yeah. And to get your hands up between you and whatever is coming at you. You see this with pre-fight indicators. If you like watching cop videos where there's interactions between the police and people, you know who's going to fight because their elbows start bending and their elbow goes to 90 degrees or more. At that point, they're either doing this or this. So they are in a fight or flight situation.
All those cues sound like what I did at the dinner table.
It depends on how you grew up. Some dinner tables were pretty stressful.
I have 7 siblings, so all those things. I'm like that was me at dinner. Sorry.
Yeah, absolutely. You got to guard the plate and ward off attackers with your left hand and just shovel with the right hand. Yeah,
that's right. You might get a fork in the neck. I don't know.
You might. No, but one of the main things that happens in the body when you're in fight or flight is that the blood flow distribution changes. This is something people don't know about the nervous system that I wish they did, is that your nervous system is in charge of where your blood flow goes, not the whole body, not even the whole brain, gets the same amount of blood flow at the same time. It just comes down to an efficiency question. So when you're ready to fight, the blood goes to your heart, to your lungs, to your brain, and to your skeletal muscle. And not even all of your brain, it goes to the lower brain, the brainstem, the emotional centers, and the sensory centers. And it just kind of leaves your prefrontal cortex off because rational thought is, one, expensive, and it takes a long time. When you're fighting for your life, you're going to be very reactionary. You're going to be very impulsive. You're going to be very emotional. That's what's gotten humanity this far. That's kind of what our brain is primed to do. And so that's where the blood flow goes. If you don't come out of fight or flight, then you're trying to do jobs where rational thought is demanded of you, but the blood flow is just not getting to that front portion of the brain. So it's more difficult to think through complex problems. The blood flow is also shunted away from your organs, away from your liver for detoxification, away from your spleen for immunity. It's shifted away from your digestive tract because if you're running from the proverbial tiger, digesting lunch does not matter. If you make it, you can digest it later. Right now, we have to run. So everything that's involved for that, so you end up blood flow to your skeletal muscle and stuff like that. We also end up with a lot of muscular tension. And you don't end up breathing as deeply, which means your oxygenation levels drop. So that means more muscle tension on top of that, which leads to chronic joint pains and tightnesses and discomfort, and leads to like gut inflammation. As you know, that blood is just shunted away from that, less healing. Your healing processes are turned off. Again, all of the energy is just focused towards survival only. Because the difference between getting away and making it could be a couple of feet over the course of 100 meters. Like, that's a narrow frickin' margin. So absolutely everything is needed for survival. Our bodies haven't caught up with the fact yet that we live in such an incredibly safe time. Relatively speaking, this is the safest time in humanity's history ever. Your odds of dying a violent death right now are incredibly low. But our biology still reacts as if we lived like 400, 500, 600 years ago, where you're still dealing with wild animals just on the routine. And you might die at the age of 12 being mauled by a bear in your backyard.
Or having dinner at Paul's house, evidently.
Right.
Could have been the two things. Yeah, we didn't know that.
It'll make you think twice before coming over. But what you're describing, so fight or flight, when I think about that, it certainly is it seems like a small moment of time, like fight or flight, right? That it's going to be minimal. But what you're describing sounds like your body's staying in a sustained fight or flight, and this is what's disruptive.
Exactly. And that's where the problem lies. It's not that you're in fight or flight. It's important to have that response in emergency situations or in stressful situations. The problem is when you stay there when life has calmed down. And so that's where you end up with like lack of blood flow to the guts, lack of blood flow to the organs. And then that detox and digestion process that's supposed to kick back in doesn't kick back in again like it's supposed to. That's the real problem, is staying pinned at red line.
You can help with an adjustment that helps with the blood flow and the organ. And that, like, how would you treat someone then? What is a pattern of treatment then that you would be able to, if you can share that?
Absolutely. No problems at all. So the way I treat patients, there's the basic model here. It describes this buildup of tension around the spine. The spine is my primary in to the nervous system and to the person's health. Being a chiropractor, that's the main thing we deal with are the joints of the spine. There are other joints we can adjust. For instance, the wrists, the hands, the elbows, shoulders, and everything in the lower extremity. And those can be used to good effect, but primary thing is the spine. There are muscles that connect to the spine, and then the joints that house the nerves that connect to the muscles that run the muscles that connect to the spine. So there's a 3-part problem there when things just pinned at redline: the muscle tightness, the nerve inflammation, and then the joint restriction. So I will adjust the joint to get things moving in proper relationship with each other. That will decrease inflammation. I will use laser therapy to calm down the nerves, to stimulate the healing, the blood flow in that area, and decrease the inflammation. And then I'll do muscle work. So either stretches or a massage gun or a shockwave device, which is more akin to a jackhammer. It puts sound waves into the body and breaks up scar tissue, adhesion, and problems like that. And that way things can get moving again. And we get out of that pattern of tension and of fighting, and we get into that pattern of relaxation and opening up. That whole process takes about 30 minutes I usually start with muscle work, get things relaxed, and open up the spine to where that adjustment is deeper, more comfortable, and I'm not fighting. So that helps me with longevity of practice. So my hands are, is less effort per adjustment for me, but then it also translates to this principle of minimal force required for the best outcomes of the patient. I want things to be as gentle as possible, and I want them to last as long as possible. And then before they leave, after having had that adjustment, which is, I'm moving joints around their spinal cord. It's impactful. It's deep. It's very central to the body. Before just taking them from that experience and putting them right out into Fort Worth traffic, just no transition time. I just have them chill out on a reclining chair in a quiet, dark room with some gentle music playing. And then we use the laser therapy to help to just set everything. Okay, let's collect ourselves. What just happened? How do things feel? Let's take some time to breathe deeply and relax, just chill before going back out to encounter the world.
Yeah, that part alone sounds valuable. Seriously,
Paul
how often do we
sit in that chair and just listen to music? Yeah,
exactly. I'm just
y'all can come up as often as you want. Now the drive.
Be careful, Dr. Nelson.
Area, right?
We are, but we are up in Fort Worth on an unusual amount of time, so we'll be swinging by.
Well, consider yourselves on the guest list. Y'all can drop by anytime.
And consider yourself forewarned. Kidding.
Your terms are acceptable.
I wanted to come back to the collaboration and more of maybe an ideal world, because it sounds like you're making some impact. You're making some steps and strides. But if you could really paint a better picture or clearer, what role do you think that chiropractors should play in this multidisciplinary care team type of environment, especially for people that are maybe in chronic pain or have musculoskeletal type of disorders? What would that look like, either from a business model or communication? How would you just draw it up and improve it and just say, this is what we're going to do?
I hope that every clinician listening to this would ask their patients if they are under chiropractic care, because there are, with careful, appropriately dose adjustments, make everything better. There are only a few situations in which it is not prudent, in which case you would modify care dramatically. Bone softening diseases, hypermobility, active cancer sort of stuff. You have to exercise extraordinary caution around those situations, right? But barring those sorts of extreme things, which we screen for, we look for, everyone should be getting routinely adjusted. And I think you would see a dramatic decrease in chronic inflammation, dramatic improvement in autonomic function. So that would impact all of the gut-based disorders, regulation of the body, regulation of hormones. I would love to see chiropractic being more mainstream in labor and delivery. Whether or not a hospital would bring in a chiropractor to do that, there are more chiropractors in hospital settings now where they do cooperate with the other clinicians there. That's starting to happen more and more. Wonderful sign. Really phenomenal for the best outcomes of the patient. And I think it could save with a lot of unnecessary surgeries and just help with the progression of labor, which is something that is of huge concern to the hospital, not just from a business model, but also people want to come in and have a baby. Cool. Let's make sure the body's actually ready to do that. Think of us almost as the offensive line. So you're going to have the ball is going to be passed, but we're the shield, we're the protector around the patient to keep chronic inflammation, chronic illness, and just chronic distress at bay and create a space where they can actually heal. And then certain chiropractors are ready to step up into the quarterback role where they're actually the ones distributing the ball and saying, this is what we're doing next, calling the plays, calling the shots. And then we're going to have the superstars who actually catch the touchdown, who actually do the things, who do the knee replacement, who do those sorts of things that we cannot do, and that do those specialized jobs where it's really life-changing. I would love to see that sort of a setup. That's going to take on a variety of situations, depending on if it's a hospital setting. That's going to be very different than a private practice setting. And so what I hope is that people look at and really value the best outcomes of the patient, look at the evidence that supports this, and say, hey, how could we incorporate this to really just give the patient the best experience possible? That's going to drive reviews, referrals, business, all of that sort of thing.
And patients feel better too. It's a good sign.
Which, private equity aside, they can go, I don't like private equity in medicine at all. They have no business in it. They have started to take an interest in things, and I wish they would go jump in the lake. The whole point is the patient getting better, not the insane profits you can pull from things when somebody's in distress and you have them over a barrel. I'm going to stop myself.
Yeah, I don't want to go down that wormhole.
Let's not do that. Let's not do that today. Let's not do that today.
That's a slippery slide.
And no
right
disrespect
there.
to the clinicians. Yeah, no disrespect to the clinicians.
No, I don't
even.
even.
Absolutely, level best to take care of people. Like, I love them
for sure. But like I've said, I think that most of them are out there trying to do what you're doing, just take really great care of patients, and are just caught. Yeah, I can't tell you how many people we've talked to that would love to wave a wand and change the system, and so that they can spend more time with patients, just like you're doing. And it's just not.
It's possible. It's possible they
friendly.
need to do a little bit of research.
Yeah.
But
it's not that they want to see more patients. I promise. It's probably being able to go deeper. Have
people
some
will pay
relationships.
more. People will pay more.
Well,
People
I think
will
we're
pay
starting
more
to see
for
that
for that concierge access. Yeah, especially as insurance is charging more and more and covering less and less. It's getting irrelevant.
We've talked a little bit about the history, and you've given us some indication on what things have evolved and changed. Where do you think the chiropractic practices and medicine is going in the next decade?
I think it's going to take a strong leading role side by side with primary care, to where, chiropractors are educated to such a state to where we're able, at least I'm going to comment on the state of Texas here. Scope varies, actually pretty widely in the union. But here in Texas, we're licensed to take care of neuromusculoskeletal conditions and the things that affect those. So that's a lot of ground. So if you come to a chiropractor in Texas, you should be able to ask about a lot of different things and get some basic, general health advice about how to stay healthy, how to keep your immune system up, and to do those sorts of things. If you have an acute ongoing disease process, you should see your primary care physician. But the first step really should be, and I think it's heading that way as chiropractors develop more and more relationships, the stigma is wearing off, and people are starting to see, hey, the kids who are getting adjusted are behaving better. They're reading better. They're writing better. They're more emotionally regulated. And people are like, what are your kids doing? Oh, they go to see their chiropractor once or twice a month. I think that's where our real shining future is in that pediatric, and then growing out from there in family care. I see a strong motion headed that way. There's a lot of pediatric specific chiropractors around me in the area, and they're full. They're full. People are really looking for that natural, holistic, person-centered approach.
If you could push that a little bit quicker with a simple message, what would you want physicians listening to this to know about, or maybe understand a little bit better about chiropractic care?
It's a lot easier to raise healthy children than it is to fix broken adults. So give them the referral early to go see a chiropractor and get under care, and don't wait for the emergency to arise to have to go snip, prescribe, use a needle. That's still valuable, but let's really get back to keeping people healthy from the jump, and then have the reactive medicine ready to go for those true trauma emergencies.
So it sounds like intervention at a younger age, being able to identify that during pediatric years is really important.
Tremendously. And you'll see that babies who are getting regularly adjusted hit their mile markers at a much, much higher percentage than children who don't have that benefit.
I can't even fathom how you would know. You're just saying that they should get treated regularly, or how would anybody even know that they're, even as a parent, I've got kids. How would you even know that that would be something your baby would need?
Well, so the chiropractors are trained in how to check and analyze a nervous system. If you have, kiddos under 7, I would take them to a pediatric specific chiropractor, because the amount of things in the development that are going through, you want somebody who's specialized in that. There's so much change, especially in those first 7 years. You could argue even up to 14 years that's going on. So I would take them there. Remember that there are 3 levels to chiropractic. There are the symptomatic problems. There's the strengthening problems. We want strong, healthy children. And then there's the optimizing sort of thing. Everybody can benefit from the optimizing if they don't have any weaknesses, any incoordination. If they have no symptomatic problems, they can always benefit from that 3rd level of chiropractic, no matter what. Now that's going to be more spaced out, like monthly, quarterly sort of visits, depending on what the doctor there recommends. But if you are wondering, look for digestive problems, look for gut inflammation, look for lack of regulation, look for emotional outbursts, look for trouble sleeping through the night, look for, those sorts of things that show you signs of nervous system distress. Follow up with any additional, specialists that may be needed. Look at airway. Airway is huge. You might look at, I'm talking ped specific in this case. Tongue tie restrictions, look for which ones are functional, which ones are actually restricting airway, and which ones the tongue can still move. And get them into a chiropractor and just get them checked early. Because that way there's only a month for things to build up and get bad instead of, years for things to grow in a funny way, or things to not grow straight, or for tensions to build up and chronically impact that young, sensitive nervous system that you're trying to raise into a beautiful person.
It sounds like it should just be part of your regular primary care, the way you're describing it.
All of the evidence points that direction, and that's my wish, that people would consider it that way. Yes.
Yeah. I had never considered something like that personally, and just because we don't understand it. And I think that's a hard, when you're describing, I got to be candid, when you're describing some of those symptoms in kids, the indicators that you're talking about, that sounds like a normal, cranky, growing child, but it sounds like we can't just necessarily take that as okay, well, they're just in a bad mood, or they're just a kid, and that's just the way they act. And then there might be something actually going on.
Absolutely. And there's a range of normal, and normal should be spelled with a capital N, in my opinion, because it means as things should be. And then there's what's common. And I think the past 5 years, especially, but maybe 10 years, maybe a little longer, has shown us just how wide that gap can be between what's commonly expressed as like behavior in public, where you can see children behaving in certain ways, missing mile markers, not being able to read, not being able to write in cursive, not being able to spell, things that were absolutely basic, even 50 years ago, to where there was a level that was expected of kids, and they met it, the vast majority of them, very easily. If you look at the difference in 8th grade education between 8th graders now and 8th graders 50 years ago or 100 years ago, the difference is absolutely staggering. And so I think we've slowly been cooked in that, the temperature's slowly been turned on what's weird. And that's now just become commonplace, and people confuse that with normal. It's not normal for kids to have these sort of like hypersensitive stomachs to food, their responses to situations, so just like the socially turned off, like not being able to interact with people, no firm eye contact, no good handshake, even from like, young boys as, 6, 7, 8, like that used to be a thing. We don't see that anymore, where they're very shy, they're very standoffish, they're not confident in themselves. They're not strong. They're not coordinated. They're falling down. They're breaking more easily. They're hurting themselves. They're much less pain resistant. So it's been like this slow cooker sort of situation where public health, and obesity, like, oh my God, like our children are getting more frail as we go. And it's been a slow, gradual thing. So it's hard to notice like, hey, when did this start? You could point at, probably the early 70s when we started introducing a lot of vegetable oils and seed oils. That is a conversation for another time. But I wish that.
I don't even want to talk about that because I just watched the video on it
more often. Oh yeah, it's engine lubricant.
Yep.
Go figure. It doesn't agree with us
anyway.
Hey, I wanted to ask you a quick call. We got into a conversation with some friends the other day, and they had put a cold plunge at their house. Do you have an opinion of that as someone who looks at the body? What are your thoughts around cold plunge and saunas? And they went into this whole hot, cold and debate. Can you share your thought around this?
Temperature therapies in general are very helpful for people, unless you have a weird situation that makes you hypersensitive to cold or heat. I think people take cold plunges way too far as a rule. A quick plunge up to 3 minutes, you're good to go. Honestly, if you reach 3 minutes, you're a stud. There's a lot of it. Contrast therapy is very helpful for setting perspective. It's really helpful for reaching perspective. The nervous system will react dramatically to things that are outside of the norm. And if you set that norm at super hot and super cold, then you're going to be more likely to be comfortable in the middle, and your brain will have a frame of reference for a lot of those things. If you live in a permaculture sort of situation where everything's wiped down with Clorox and it's always 72 degrees inside, your odds of, having allergies or getting sick from something or getting infected or just having nervous system dysfunction at 85 degrees is way, way, way higher because your body doesn't know anything different. So in general, I'm a fan of those.
Excellent.
I was actually thinking of the same thing, Chris, in terms of like some of the maybe other practices that I've seen or even been into have added, multiple types of therapies, whether it's red light therapy, cryo, or that, maybe just to add to the business model or to the treatment. I'm just curious how you evaluate whether or not that should be part of your practice, or if you're looking at those things, or no, I just want to stay in line with trying to communicate with other physicians rather than some of these other, I don't want to say fads, but it does seem like the cold plunge thing is certainly a big one right now.
Oh yeah. So I love to tell people, watch out for hype and avoid it. There's always some amount of truth behind hype. But like I said, like cold plunge goes too far in a lot of cases. You have people out there trying to do 10 minutes, 15 minutes or something like that in an ice bath. Like, unless you're specifically training to go do stuff in like super, super cold temperatures and you don't live in a cold area, okay, then that's not for you. The vast majority of people would benefit from a cold shower every once in a while and sauna 1 to 3 times a week. And I think that would be a great part of recovery. There's some great Norwegian studies on the benefits of sauna, especially for children. Increases in growth hormone can go up to 16 times higher, depending on how often and how long you do it and at what temperature. So, depending on what you're trying to do. If you're just trying to live a normal life and you feel pretty good and you're wondering, do I need to add these things in? I'd say no. If you say, hey, I want to feel better, I want to sleep more deeply, or I'm dealing with some pain, I want to make sure I get some good circulation going on. Hey, sauna's fantastic. Sign up with a gym that has one and don't shell out $5,000 for one in your house. If you are like, hey, I really want to make sure I get all the benefits of growth hormone and like all these things, I want to do this daily. At that point, just get one for your house. There's infrared saunas available for, I think they're pretty economical at this point. It's pretty cool. Just remember to factor in the power bill, but go for it. And so it's a question of like what you want to do as far as like how healthy do you want to be? How big of a priority is this for you? I think for most people, they want to be healthy enough to live their life, love their kids, go to work and not hurt. And so for them, like once a week, fine. I want what the patient wants. And not everybody needs to be doing, health maxing, as I guess the kids would say these days.
Yeah. That's one that I get to keep up with the kids too. So, well, listen, this has been great. The question that I have last for you is the name of the show is The Patient Physician. And I'm just curious what that phrase means to you in this situation.
So the patient physician, I like this. There's 2 things that it means to me. And I was intrigued by the name of the show too. So I'm so glad to get to be on here. One is you have to be patient with your patients. Healing takes time. There is no process that doesn't take time. And healing is a process. It's not something where I can just snap my fingers and people are all better. As cool as quote unquote miracle adjustments are, where you give someone one adjustment, they get off the table and they're perfectly fixed. They're rare. The vast majority of time, healing is a process. So you have to be patient with your patients. And that means that hopefully your business has room to flex around people when they need a little bit more time that day. And the second thing goes back to this idea of physician, heal thyself. Does the doctor take his own medicine? You better. First off, especially as a chiropractor, if you're not getting adjusted, come see me or go see another chiropractor. You need to. You're going to be more congruent. You're going to be more confident. You're going to feel better. And you're actually going to set the positive example, because people don't really do what we tell them to do. They usually do either what they think is best or what we do if they're following our example. And so I think it's really important for doctors to take their own advice and to make sure that they're getting taken care of. And for doctors who are not chiropractors, go find you a friendly chiropractor and go get checked. It's going to make everything in your life better. And you might be really, really surprised how much better you can feel than what you're used to.
Well, again, thank you for joining us. The insight on some parts of our conversation, specifically around kids, has been pretty intriguing. Sort of wish I had heard some of this information earlier, but I guess it's not too late. My kids are not all grown up yet, and so we can still make the difference there. But Christian, thank you for joining us to learn more about what he's doing at Advocate Wellness. Check out the show links in the notes section. Thank you to our listeners also for being part of the show and the patient-physician community. If you enjoyed today's story, please like, subscribe, and share your story with us because there is someone patiently waiting to hear it. Thank you so much.
Thanks, Christian.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects Podcast Network. Please email questions or show ideas to info@physiciansrs.com.